meeting, the Bangalore IMA, Indian Medical Association. Just around a week or 10 days ago, we were celebrating the Doctors' Day function in Chancery Pavilion here in Richmond Road. And then I met a professor of general surgery, and he had just retired from one, I think, government medical college, and then taken over as, I think, the third unit HOD of a private institution. I'll not name the private institution. And he was just lamenting about the general decline in the quality of the students who really come to these private medical colleges. And because they're paid 1 crore for MBBS, or they're paid 5 crores for MS, orthopedic general surgery, or something like that, there's tremendous pressure on the teachers to pass them. And the students are least interested to learn because they've got so much of money. So how knowledge will enter? They're least interested to learn. And
so why do you think they're entering? Sorry, why do you think they're entering the system in the first place? They're not interested in studying.
I think they're interested in the certificate. They just want to get the MS certificate or the MBBS certificate. If they get it, they can
status.
And status. And then if their father has a medical college or some kind of a nursing home or a hospital, they can run it or be a manager there, and that kind of a role they can have. And mint more money. And if they invested 5 crores, they have to make 50 crores. That pressure is always there. So that kind of it's sort of become more of a business than academic. Traditionally MBBS has been an academic kind of thing where you really slog, you learn, you become the best in your trade, and then you serve the patients, and you treat the patients, and that's been the basis of it.
Hi, today I'm talking to Dr. Srikanth K on the Idea Sandbox podcast. Why am I talking to Dr. Srikanth? He is a distinguished orthopedic surgeon based out of Bangalore, India, who is a fellow of the Royal College of Surgeons, England, FRCS as it's popularly known as. He pioneered the Joint Vedo Technique, which is a regenerative arthritis treatment technique, as well as he pioneered the robotic computer-assisted knee and hip surgery techniques that led to maximum accuracy as well as better patient outcomes. India is home to the second largest knee pain sufferers in the world, and I think it's important for me to chat with him and see what his ideas are on solving some of these problems. He is a very passionate individual. He has some great ideas in this space, which is self-evident with some of the initiatives he has taken. He's performed thousands upon thousands of knee and hip replacement surgeries. That has gained him a lot of fame and reputation in this field. He isn't afraid to speak his mind, and today we're going to talk about various topics that are related to healthcare challenges in India. We're going to talk about some of the private medical school education and some of the challenges with that related to expenses, the cost, and the number of medical students that are enrolled in schools and so on. And from that, we go into medical equipment that's imported from abroad, some of the challenges with using those equipment in an Indian environment with the kind of biomechanics and ergonomics that affect Indian physicians, I should say, and surgeons. And then from that, we go on to talking about preventive healthcare. How much preventive healthcare is there? It's an emerging field in India, preventive versus curative healthcare, and so on. Please enjoy this podcast as much as I did having the conversation with Dr. Srikanth. Thank you very much.
Yeah, so Dr. Srikanth, like we were talking last time, there's some issues in all aspects of the medical healthcare space in India, and we touched upon it last time. And I guess this time I want to pick one particular topic, which is that of this the number of medical seats in the country. So I was just I was trying to do my background research, and so one of the things that popped out at me was that the number of applicants per year that are trying to get into med school is about 21 lakhs, and the number of seats available is little above 100,000, which is a little more than 1 lakh. There's also a video I think I'll link to you, and I'll probably splice that video in. There was this I guess a student who was trying to get into med schools. He was talking about this kind of racket that's been running, where many politicians actually run these colleges. They own these medical colleges, and then they try to recoup it because, with high fees and donations and whatnot. I guess I was wondering if you have anything to say about that in that space, and maybe kind of expand on that, because you've obviously come out of the Indian medical system. I mean, medical education system. You did your MBBS in Bangalore, as I understand, right? I guess I'll let you talk about that.
I mean, say the whole idea of this podcast for me is, how to improve the system. Because India has got a target of becoming a developed world in 2047. Personally for me, it's too far, because I don't know if I'll be alive in 2047. So for me, it has to happen in front of my eyes. Now, and then only it's a reality. So my vision for my own country is that whatever development has happened now, not in 1,000 years from now, it will be pointless, really. That's the idea behind these podcasts and how we can improve the system. And I think medicine has always been competitive. Even I remember my MBBS time. I had to score, I think, the 57th or 58th rank for the state of Karnataka to get into the premier institute, Bangalore Medical College and Research Institute, which is the #1 college for the whole state of Karnataka. So the competition has always been high, and you have to burn the midnight oil. And the statistics you gave, 21 lakhs waiting or applying, and 1 lakh getting through. I mean, so I'm not surprised with that. That's quite true. And what you summarized, what some medical student told you about, how the whole thing is happening is also true, actually. So I think, yes, there are two aspects. One is the government medical college. Second is the private medical college. And I remember my student days where we always used to have a strike to prevent more private medical colleges from coming, because we wanted government medical college where premier institute, a lot of patients, proper training. The doctors coming out of the government medical college are really grounded doctors who are well trained and safe on the Indian patients. And that's what is a standard of care which I think the Indian patients deserve. So, nobody wanted mushrooming of the private medical colleges even at that time, 25 years back. And, it's the same ethos is there. But I think it's a little bit more commercialized now in 2023, or, in the last 5 to 10, 15 years in India. And as you correctly said, all the private medical institutions are owned by very rich people, usually with some kind of a political connection. And it's a big business. And, because there is a investment, in a sense, investment on the land and investment on the infrastructure and things like that. May not be equipment and things like that, but at least the land and the building and everything, it costs a bomb. And since they own these kinds of institutions, obviously they want a return on investment on that. So the return on investment comes by, for example, in a private institute, I think the going rate, if I'm correct, from my research, is that to do MBBS in a private medical college, it costs you 1 crore rupees. So that is the going rate. And to do a post graduation, a MS or MD in India now in a private institution, cost between 5 to 6 crores. And the top ones are the radiology, which costs anything above 6 crores, I think. And then you got the orthopedics, which can cost you 5 crores. Medicine can cost you again 4 crores. So this is the
these are at the private institutions, right? Sorry to interrupt you, but these are you're describing the figures from private institutions, not the government colleges.
Yeah. These are the figures from the private institutions. So government institution still, it's a merit based. You have to do a all India exam called the NEET, and you have to secure good ranking. And usually, the appointment is through that. And then I think the fees are reasonably capped. I think it's a little bit increased now, but it's reasonably capped. It's not like crazy, like 1 crore and 4 and 5 crore. That's completely unaffordable by a meritorious student. Really, only some money bags or their children can buy such kind of tickets. And very interestingly, I was in a meeting, the Bangalore IMA, Indian Medical Association, just around a week or 10 days ago. We were celebrating the Doctors' Day function in Chancery Pavilion here in Richmond Road, next to Richmond Road. And then I met a professor of general surgery, and he had just retired from one, I think, government medical college, and then taken over as, I think, the third unit HOD of a private institution. I'll not name the private institution. And he was just lamenting about the general decline in the quality of the students who really come to these private medical colleges. And because they're paid 1 crore for MBBS, or they're paid 5 crores for MS, orthopedics, or general surgery, or something like that, there's tremendous pressure on the teachers to pass them.
Mm.
And the students are least interested to learn because they've got so much of money. So how knowledge will enter? They're least interested to learn, and
So
they
why do you
all
think
the
they're entering? Sorry, why do you think they're entering the system in the first place? They're not interested in studying.
I think they're interested in the certificate. They just want to get the MS certificate or the MBBS certificate. If they get it,
Okay,
they
it's
can go into,
status.
yeah, and status. And then if their father has a medical college or some kind of a nursing home or a hospital, they can run it, or be a manager there, and that kind of a role they
I
can
see.
have and mint more money. If they invested 5 crores, they have to make 50 crores. That pressure is always there. So
Mm.
that kind of it's sort of become more of a business than academic. Traditionally MBBS has been an academic kind of thing where you really slog, you learn, you become the best in your trade, and then you serve the patients, and you treat the patients, and that's been the basis of it. Now, so much of commercialization now that 1 crore somebody's invested, he wants to say, when can I make my 10 crores? So obviously he's forced into all kind of unethical practice at the end of his BBS or at the end of MS, because he has to recoup his 5 crore investment that he has done. So I think this is a present state really, and I was quite shocked when the professor told me that the management is really pushing them to pass these guys, because once you pay 5 crores, your entry is guaranteed, your exit is guaranteed. It doesn't matter what quality you got. So the
Yeah,
management wants to make sure that they get that the degree what they have promised in year one with the 5 crores donation. So that's not really good, and I don't think that's good for the Indian patient really.
right. Yeah, and I mean, these are just jaw-dropping. Is this, excuse me, um, is this kind of phenomenon of this, kind of a broken system, so to speak, been around for a long time, or is it in the recent times? I mean, how bad has it been historically, and I guess how have you seen things improve or change or degrade?
Yeah. If I look at my own, I mean, when we are doing MBBS, I participated myself as a student to block private medical colleges from coming in Karnataka. So at least I have participated in 2 or 3 strikes actually. I never
Okay.
knew as a student why I was participating. So everybody is doing, I was also part of the strike. But now I realize what I was doing. I think this anomaly has been there for long. Even at our times, the mushrooming of private medical colleges have been there. But I think in the last 15, 18 years in India, it's become really bad, and it's become like for all. And I think
Mm.
everybody participates in this. It's not that yeah, somebody has is a money bag, he wants to have a medical college, he knows 5 crores is a big amount of money he can make per student, and that's a huge amount of money. So everybody turns a blind eye. Okay, whenever there is
Mm.
fees keep on increasing and these capitation fees keep on increasing, nobody takes action, neither the police nor the regulatory authorities, nor even the courts. They turn a blind eye. And whenever there is medical negligence, then all the courts wake up and say, oh, these doctors, they're doing this and that, and let's put 5 crore compensation, 10 crore. But you need to go back to the root cause of this. The root cause of this is this, what is happening, because money backs coming in, with a lot of money, and they just want a certificate, not training. So unless you address it at the root cause, the malady cannot be really addressed really. So you're just saying turning blind away when the fees increase, court has to take so much of cognizance, say, why is the fee so high? How are the general merit category students going to pay 5 crores? So what will be the outcome of these people coming through 5 crores? Are they really learning anything? Are they safe on our patients? This is the role of the judiciary and the regulatory authorities, which sadly is not happening in the way it should really happen ideally. Yeah.
What do you think is the solution? I mean, if private colleges are coming out because there's a shortage of government medical seats, is it that the government we as a country have to prioritize medical education, and we have to invest more in that, and try to keep that kind of private education sector at check? Or what do you think is the solution? Because I mean, end of the day, we need more doctors in India. We I was looking at some numbers here. This is with neurology, for example, not related with the medical, I guess, healthcare space in general, but the number of neurologists in our country is just a little bit over 2,000 neurologists in the entire country of India, right? Like 1.4 billion people, and the ratio is it's astronomically skewed, right? And so when I look at a number like that, I mean, we we need more people. We need more people who are skilled. Our outcomes need to be better and things like that. Because last time we spoke, you said the outcomes are also not as great. What do you think is the recipe to get out of this mess?
Yeah, I think investment more in medical education and healthcare, and probably investing more in the government medical colleges, because already these infrastructures are there and they are catering to huge amount of patients who are coming as well. So and it's free treatment for patients as well. So it's a win-win kind of model is already there. So I think the money has to be put in a government sector, and a check has to be made on the private sector, because if the private structure, facilities had real intention that, oh, let's educate our people, let's get better doctors, then that's a completely different ball game. But here it's just a business thing. You have a kind of a shell, and then you get the examiners once in a year in buses, you get the patients in buses. For when the MCA comes for inspection or NMC comes for inspection, patients are bought, and examiners are bought. A whole kind of artificial hospital is created. Then the inspectors say, okay, everybody is there. This college gets a recognition, and that's fine. The next year they can charge more crores, and this kind of keep on happening. I think that is a downward spiral really. So downward spiral, for the Indian patient. Forget about all the politicians who are making money out of this and all the people who are part of the system. But end of the day, who is going to suffer is the Aam Aadmi, or the average
Right.
Indian is. Yeah.
Yeah, I mean, we spoke about a little bit of this last time. If something like a change like this has to happen, me and you speaking on a podcast is one way of raising awareness to all of this stuff. But rubber meets the road. What is the real thing that can be done? Is it some political candidate that stands on a platform that says, all right, I'm going to look at actual data and then do the whole system design such that we put out more doctors per year, the quality of education is high? Is that the solution? Or is it the medical fraternity of doctors come together, form this kind of advocacy group, and then advocate on the behalf of the whole country, so to speak, and say, look, we need a massive kind of intervention, right? This is an intervention we're talking about. We're not talking kind of incremental adjustments along the way here. We need some big levers to be pulled, big changes to be made, if we want to see health outcomes to improve.
Yeah, I think there are two solutions to this. One is bottom-up approach and the top-down approach. The top-down approach, you mentioned good leadership. A leader can come and say, look, we have to prioritize this. This is a rotten, and we can't continue, because tomorrow I'll be old, and one of these doctors from a private medical college who has paid 5 crores, who are not attending a single class, can be treating me and treating my heart attack. Okay, and my life as a politician, or neta, or a babu, or a judge is precious. It is not to be frittered away.
Right.
Okay? So it's in my own selfish interest that I produce quality graduates, not just medicine, but all the fields in India. That's the Neta top-down kind of approach. The bottom-up approach would be the people, the people of India. I think they should make health and medical education as an election issue. Okay, so now we are still 70 years down the line, 75 years down the line, we are still fighting on Mandar Masjid, caste, subcaste, language, creed, sub-creed. This is how elections are fought even now in 2023. It's really shameful. World is moved on, but we are still there in caste, subcaste, language system, and fighting elections and fielding candidates like that. So we're still in a very archaic kind of society, really. So we have to wake up and say, hey, hang on a minute, the real issue is health. Real issue is water. Real issue is unpolluted air. Real issue is good roads. Real issue is education, electricity. These are the real issues. So let us, make the election issue about education and about healthcare. Getting a quality free healthcare. Let's make it as a campaign. So when that happens, the netas also feel, yeah, now the population is interested in the healthcare. They're interested in medical education. Let's invest there. Let's change the system. Let's shut down the private medical colleges, or if there are private medical colleges, let's what they say, nationalize it. Take over all the private medical college, make them into government. Already the land
hold
is
them
there.
to a higher standard.
Yeah, building is there. So all that you do is whatever you do recruitment in the government medical college, do the same thing in private medical college. Take over, as simple as that. So that could be a solution also. So I think both the public have to demand and the netas have to really think laterally and into the future and produce solutions really.
Okay. Changing topic, I guess, move on to the next one rather. You and me had an informal discussion when I was in India recently. We were talking about procuring biomedical equipment. In your instance, it's a robotic surgery equipment, as I understand. And you were making a point, or maybe lamenting, so to speak, that the equipment that's made abroad, like in the West, for example, is predominantly designed for that kind of a population. So the dimensions of an equipment might be well suited for a Western doctor. The physical dimensions and so forth. We need something more that's more indigenous, like coming out of India, R&D to be done in India, and things along those lines. I guess, can you speak about that in general? Like, what you are a hospital owner, you're orthopedic doctor as well, and you're dealing with this head on, like face to face rather. And what is your like when you have to buy a new piece of equipment that comes out, let's say in America or Europe or something like that? What are the trade-offs you have to make? Like, is America and Europe the predominant manufacturers of these things, or there are other cheaper sources, but the quality is not as high? I mean, I guess I'm very uneducated. Could you maybe educate us about that?
So I think, I think this is a real problem actually, even now in 2023. I'm into robotics in the last 2 years here in Bangalore. And, the issues the top robotic surgeons in the country are facing is that we have to import all this equipment either from US or from Europe or other developed countries. And, naturally, somebody in Europe or America, he may be very tall, well-built, 6-footer and things like that. So these robots are also designed, the handles, the robotic arms are designed for those kinds of dimensions really. And if you go to different parts of the world, the human anatomy is completely different. Somebody might be very short or somebody might be very, very thin. So, when that happens, the robot is too big, too large for that. So then there is no customization. You can't really cut the robotic arm into half to use it for a shorter patient really. And I think that's the real situation the top robotic surgeons in India are facing right now, because these are all designed for the Western population. And when they bring it to India, they find that, oh, I wish this was like a 1 feet shorter. It would have been ideal. I could have operated much better and smoother on our patients, and that's the kind of a real issue. I think a more fundamental issue is, are we really in India investing in R&D, research and development? That's the bigger issue really. And I don't think anybody is really serious about that. Neither the government sector or the private sector is very serious about the R&D, and research is not really given that amount of importance. We are basically like, even if you look at the software, we are more of a service sector. We are servicing whatever is happening in the West rather than innovating and producing new softwares and new ideas here in India. And that's been the tradition, and our people are very happy. Our managers, CEOs, CFOs, they're happy as long as the money is being made by replicating, by kind of a service kind of industry. They're happy. They think, oh, we've done it. We've produced these numbers. We had 5 crores, next year 10 crores, next year 20 crores. That's all they're bothered about. They're really not thinking about R&D and innovating and producing new ideas really. And I think that's where things are lacking. And again, bringing technology from the West to here, you face a lot of red tape and things like that. For example, before the COVID, there was a company near my house in UK, in Gloucester, who are doing this vacuum cement mixing. It was a great idea. I had used that in UK. I thought it was an excellent idea. It improves the cement strength and everything. And that guy came to Bangalore and he wanted to sell, and I tried to help him. And he bought a big consignment to Chennai. And then, he had to bribe in the Chennai airport, in the internal customs department, the double amount of the cost of the thing. And he thought it's pointless. Why should I pay 100% of the value of the goods? So he just left it like that. And a few years later, I met him in UK. He said, Dr. Srikanth, what I bought so much of items, it's still in the Chennai airport. And after 3 or 4 years, do you know what they did? They destroyed the whole thing because nobody claimed. So if this is the how the whole process works, then sadly we can't get all the best other thing for our patients really. Those are the practical issues really.
Yeah, I mean, it sounds like it's almost like a we need like a holistic approach from education. I mean, we're talking about R&D for engineers to be able to go and do research and that education side of things, and then we need the whole supply chain of like the developing and manufacturing these equipment, and then you need people who integrate all of these into making the machines, and then collaborating with you guys. Can you quickly describe to me? And I'll probably
one point I was just reading today. Somebody sent me very interesting.
Yeah.
I think it's the U.S. surgeon, the robot which is used for the general surgeons. It's called as the Da Vinci, and at present, the going rate for Da Vinci is 15 crores. This is a surgeon from U.S. Indian surgeon. Like me, I came from UK. This guy came from US. I think he moved to India around 5 years ago, and he said, why should we spend 15 crores for Da Vinci? So why can't we do our own robot? And he, did all the kinds of jugaad and everything. And he produced an Indian-made robot. I don't remember the name of the company that he has produced, but it's 5 crores. And I believe, they've done some 100 surgeries in Delhi using this robot, which works similar to Da Vinci. So I think, this is a kind of really lateral thinking that we need, where somebody could come and say, hang on, why pay 15 crores for Da Vinci? Let's use the same technology, modify a little bit, and use for our patients at 1/3 the cost. I think hats off to that guy. Really, what he did came from US.
Yeah.
He could really walk the talk, and he could really produce a machine at 1/3 the cost of which the Da Vinci system is in the US and other places. Really.
Yeah, I guess like rough numbers, what percentage of equipment do you think is imported versus what we manufacture locally in India? Like across the board, you talk about not just one specific area of healthcare, but just across the board. How much do you think like we import our medical equipment?
I mean, so I would say all of the high-end equipment is imported, almost all, maybe more than 90%. Okay. So because, we don't produce this high-end equipment, which are like state of the art and which can really do the thing. So the easiest thing is to import them. So, government also sort of encourages that kind of a thing. So I think only the basic level things are maybe 10% are really manufactured. Yes, there's a greater push towards Atmanirbhar Bharat, Make in India, that thing. But it has to, the idea is great, but it has to really start with our education system, where you give quality education, bring the people, make them go through the grind. It's about going through the grind for MBBS or MS. So when you go through the grind, you become a good doctor, you become a good human being, a good surgeon. Then you can start into R&D, that kind of a thing. If those fundamentals are missed, you just give them certificate, 1 crore, take this certificate, or to 5 crores, take MS orthopedics, you can go operate on anybody. Then sorry, you don't have any of the basics fundamentals. And just with the certificate, they say, the classic thing is that you can buy merit certificate, but sadly you can't buy merit itself.
Yeah.
You had to burn the midnight oil for that. Yeah.
Yeah, I was thinking the previous discussion we were having about medical school being med school being expensive. I guess what are your thoughts? I mean, this is coming from a person who has no idea in the medical space. Like, so a lot of engineering, like education, for example, software programming and things along those lines, a lot of it is becoming democratized online. So you can just go take courses. Like stuff that you had to pay $3,000 to $4,000 at one point to get one course here in the local university now has become literally under $100, right? Is there parts of the medical education that can be moved online, or is it most of it is just hands-on? That's the only way to do it, is in an actual like university setting where you actually sit with your you actually have to practice being being a doctor and things like that.
Yeah, I think maybe in engineering field you can go into these kinds of training. It's not that we don't have that kind of training. We have virtual reality, simulation training, and everything, but nothing equals hands-on training. So I still remember, spending hours together in the anatomy dissection hall in Bangalore Medical College, cutting through the cadaver, tracing each nerve in the body, each vein in the body, each artery in the body, seeing what's the relation, where it goes, where it ends, how does it supply this organ, how does, it's an amazing thing. One, it gives so much of enjoyment. Second, it gives authority. And I saw in UK, many of the medical colleges didn't have a cadaveric lab, so they were using like prosections, or they using like videos, or like a PowerPoint slides to look at the arm and the different arteries. But that's a 2D. It's not a 3D. A human body is a 3D.
Right.
So unless you are really in high-tech thing, I met a professor from France recently who has gone into 3D virtual reality, and what he's doing is, he's using all his advanced technology, and looks at the arm, and he looks at the brachial plexus, and all the nerves coming there, and it's like 3D, and he is integrated with artificial intelligence. So the AI tells which nerve is what, which nerve is going where. So unless you
Okay.
have access to something of that caliber, which is still experimental in most of the places in the world, the student can't learn. So because this everything is 3D, it's a touch, feel, move. So you have to see the patient, feel the patient, see what happens. So I think lab-based studies or simulations can only take you 15-20%, but the rest have to be hands-on and
Okay.
on the patient rate.
Okay. All right. Coming to our, I guess the other topic I want to talk about is preventative, like healthcare, in the sense that having personal responsibility, in maintaining your own health and things like that. Like I was very uneducated about things like growing muscle, for example, to prevent, injuries. Well, if you're going to be playing sports, for example, go and grow the muscles in your legs so that you'll injure yourself less and things like that. Or even to prevent heart disease, what kind of foods you have to eat, what kind of workouts, or what kind of a lifestyle choice you're going to make. How much of it do you think in India do we have that sort of literacy about health and all that? We talked about health literacy in our last podcast, but as far as preventative care, how much can we do so we can avoid things like diabetes, which is a common problem in India. Heart disease is a common problem in India. I know the numbers are low. I guess my intuition is that it's low. I've seen stuff online, but I guess more importantly, how do we steer the ship in that direction? How do we get into the whole country get into a healthy lifestyle and things like that? What if you have any intuitions on that?
Yeah, I think preventive care is sort of a hit and miss, really. So, at one level, you can say there's a lot of thing on the media and television and things about different programs and things. But
Right.
in general, I think I think in the last podcast also we discussed there's a a lot of health illiteracy in the country, and because of the health illiteracy, the quackery is still a very, very big thing in India. And if you go into that, you nicely mentioned about the exercise to prevent injury. There's a whole lot of studies being done on landing biomechanics on the female athlete. How a female athlete has to land when she jumps, to prevent ACL injury. Okay, this is a well-established thing, but again, it's not known very well in the country, and even only the top orthopedic surgeons who are into arthroscopy, maybe teaching these to their female athletes or female elite sports people, saying how you to train, which muscle you have to develop, how you have to land, so that the ACL injury doesn't occur. There's still in a maybe 1% of the people know, but majority may not know. So that is one aspect of it. And coming to my own field, because osteoporosis is a very big problem really in India, and in the West, I think the government has a very, very vested interest in osteoporosis. They go very aggressive. They do a lot of camps and things like that, and find out those who are at risk and start treating them with guidelines and medication to prevent osteoporosis, prevent the hip fracture, so that the patient doesn't spend too much time in the hospital and exhaust the resources of the health resources of the country. So, but here, it doesn't happen. A lot of people suffer from these diseases. And I remember, since I moved from UK, I should have done, without exaggeration, more than 230 or 240 osteoporosis scans and arthritis awareness scans to tell patients that bone can be weak, how you can prevent the bone from becoming weak. Simple things like walking, 40 minutes a day, 3 or 4 times a week, can prevent osteoporosis. Exposing oneself to sunlight in the mid-afternoon. These kinds of things. Simple, nothing expensive. Simple educational message. And this I've been doing for the last 10 years now, and I continue to do that. And there are organizations like Geriatric Society of India. We have formed associations, and we do conferences, and we take this message. We have a bone osteoporosis day in August. We spread these kinds of messages, really, so to help preventive care. But you mentioned something that maybe the number of diabetes or cardiac disease may not be more. But I was in a meeting, I think, quite a long time ago, I think maybe around 7-8 years ago, an association called the Global Association of Physicians of Indian Origin. So this GAPIO. The GAPIO is in fact created by the only people who are trained outside the country can be members of GAPIO. And in fact, it was created by Dr. Pratap Reddy, who's the chairman of Apollo Hospitals when he was in US. And all the top guys in the world who are Indian origin are part of the GAPIO. And in this meeting, they told me around 6-7 years ago that India is sitting on a time bomb. And time bomb is that we will be the diabetic capital of the world, we'll be the cancer capital of the world, we'll be MI capital of the world, we'll be accident capital of the world. Okay, and some maybe lung cancer also because smoking. So I was completely flabbergasted.
When did they say this law?
They told me around 6-7 years ago, maybe 8 years ago. Okay, this was predicted. They had a lot of data. The all doctors from US, Europe, and Australia, and some from India also were settled here like me. They were presenting their data and things, and they said this is going to be the future. And it is coming true. I mean, so there is an epidemic of diabetes now. Epidemic, it's not pandemic because it's not worldwide, but India is going to be hit severely by diabetic. I think probably 1 in 3 Indians will be diabetic by another 4 or 5 years, or maybe in a decade. 1 in 3 Indians will be diabetic. It's a big thing. And heart attack is on the rise. You might have heard all the young people dying as well. Dr. Puneet Kumar was one person who in a gym died, and the number of young people who are dying of sudden cardiac death post COVID as well. So, and I had a friend who came back from UK, and I met him, I think, just before COVID, I think I met him, and he was giving a presentation, and I asked him, what's the difference between UK and Bangalore or India? And he said, in UK, typical heart attack between 45-50 years. India, 25 years. I said, you're joking. Why will a 25-year-old guy get a heart attack? He says, this is the people I'm putting stents day in and out. I said, why? 25 is not the age to get heart attack. He said, see, the problem, they are smoking like crazy, stressful lifestyles, drinking crazy, coming and hiding in front of the parents, put the cigarette packet outside the house, then enter the house, maybe eat a chewing gum and enter. And that's going to only fool their parents and fool themselves. And these are the guys having and getting stents, single vessel, 2 vessel, 3 vessel at the age of 22, 23, 24, like that. And I think this epidemic might continue as well. So I think going forward, I don't think health-wise it's not a great thing to be an Indian, but maybe as a doctor it's a great thing to be an Indian because all these patients are going to come to you and pay you for your services. So hopefully, but preventive medicine is very important, and simple step. For example, osteoporosis, just walking 40 minutes 4 times a week, can be a cure for that, or having regular supplements, that can be a cure, or exposing oneself to sunlight where you don't have to pay any money. That can be a curative thing for osteoporosis. So many simple things can be done. You don't have to invest billions of dollars or trillions of pounds to deal with this. Simple things, common sense can really solve it. Plus government help in focusing on these camps, identifying these patients, and going after prevention is better than cure. If we don't invest in prevention, then we'll spend up billions of dollars curing these patients. Really.
Yeah, you were saying sunlight helps with osteoporosis. Like, I never knew that fact. Like, what is the connection there?
Yeah, so basically human skin, subcutaneous tissue has got fat, and it has got a type of cholesterol. That cholesterol is a precursor of vitamin D. So when the ultraviolet rays of the sun come and hit the human skin, so it gets converted into active form of vitamin D. So that active form of vitamin D is like a switch in the intestine. If the vitamin D is there, switch is on. Calcium that you take through diet gets absorbed. So if the switch is off, that is no vitamin D is there, then whatever calcium you give, either tablets or dietary calcium through milk or whatever, it doesn't get absorbed by the small intestine. So once it doesn't get absorbed, it can't go into the bone. Bone becomes weak. Bone gets fragility, fractures, osteomalacia, osteoporosis, fracture, and we call
Wow.
osteoporotic hip fracture as a silent killer, because you know a 1 in 3 patients having a neck of femur fracture, a hip fracture, despite surgery, don't survive beyond 1 year. So if somebody has got a hip fracture, they can sign their will, because they know that 1 in 3 will be dead in 1 year's time. That serious is the illness, and
Yeah.
that's called as a silent killer, because we know how strong our muscles are, but we never know how strong our bone is.
Right.
We can't feel how strong our bone is. We can see, oh, I got a muscle which is the biceps great. I can lift 100 kg. Yes, I can know that, but I don't know how much weight my bone can lift, because I don't feel my bone really. Yeah.
And so this is a problem universally, like the lack of sunshine, lack of exposure to sunshine. It doesn't matter if you're an American or an Indian. This is an issue you have to address. You have to get healthy amounts of sunlight, per day, whatever that number is.
Yeah, absolutely. There's a global problem. And I think first we discovered, I think around 10-15 years ago, when I was doing my fellowship, and we were looking at all the revision patients who come for redo surgery, and we found that all of them had a vitamin D deficiency. We thought, wow, what's happening? Why are they having vitamin D deficiency? And then research happened. People really looked into it into the West, and they found that I think probably more than 50% of the world is deficient in vitamin D. So, and
Wow.
the chronic patients who come for revision, it's 80%. And it's estimated that around 80% of Indians are deficient in vitamin D. And now vitamin D has been linked to literally everything. It's been linked to, also orthopedic surgeon, osteoporosis. Yes, I can understand how it's
Mhm.
related, but it's linked to causation of diabetes, causation of cancer, causation of
Wow.
stroke. And you correct vitamin D levels, there are 25 diseases you can stop. So that is the
Wow.
vitamin D really. So I think that's coming as a very, very strong message now in the last 5 years.
It's so shocking, Dr. Srikanth, that this is not common knowledge. Like exposure to more sunlight is beneficial across the board. I'll tell you what's ironic. My wife works at a hospital, and she has had to explicitly go out of her way to ask for an office for her, so that's facing a window that she has, because she's locked up in an office for 8-10 hours a day without a window. And I'm thinking, wait, the hospital should be the first place to promote all of these good ideas. And the same at my workplace too. I mean, I work at this big corporation where you're just sitting in cubicles, and there's not a window for literally hundreds of yards, right? And so, I mean, the idea there is that you won't get distracted and things like that. But then you hear research coming in from all the sites all the time that sunlight is a huge, universal cure for a lot of things, like you're saying. So is it the same in India too, that a lot of people are just not exposed to sunlight because they're stuck in offices, or the construction of their home is in such a way that they just don't have sunlight? There's a whole lot of reasons. But I think it's also, one of it is just ignorance of the problem that sunlight is such an important thing.
Yeah, I think that's what I see in my practice. Initially, I was shocked. I'm no longer shocked. I see that vitamin D deficiency is very common in the IT crowd in Bangalore.
Mm,
Okay, so but you go to a village and you just see the guy, a villager. He's got normal vitamin D. Somebody working in the
okay.
field has got normal vitamin D. But
Right.
typical IT crowd in Bangalore, get into the AC car, drive to the office, sit in the AC room all day, cut off from the sun, again drive back in the evening or night, and you check their vitamin D levels, it will be 10 nanograms, something like that. It will be really bottom. It should be 30 and
Mm,
above, but it'll be way down in the bottom. And I was thinking, gosh, these are rich people, educated, why is that? They are prone to more disease compared to somebody who's in a village, who's running around in the streets and that kind of a thing. But that's the thing actually. And other reason is the pollution in the cities. The pollution, all the pollutants go, they create a blanket between the sun and the people, and
mm,
these rays, good rays can't come in. But in a village, it's not polluted. The guy is traveling in the afternoon, maybe bare chested in the field or something like that. He's
Yeah.
getting enough amount of sunlight. He's doing enough amount of activities also. He's getting normal vitamin D, and his bones are really healthy. But the bones of the young people in Bangalore or a city like Mumbai, Delhi, others is weak because they're vitamin D deficient, and they're deficient in quite a big way.
How do you ensure that you get enough sunlight per day?
I go for a walk. That's at least 1 hour a walk.
Okay. Okay.
One time I sort of get it, and if there is an option to eat in the hospital, then eat outside. I choose outside if it's not raining, so that way I get the thing. But one has to be vigilant. Otherwise, easily you can fall into the trap. Sometimes you're so busy and we're not focusing on it.
Yeah.
And periodically you have to check your own vitamin D levels and see what's happening. And if it's deficient, you have to be on supplements. And I think in a way, COVID did a good thing for many doctors because people were not sure what was the treatment. Everybody was dosing on different vitamin Ds and this and multivitamins and things like that. So I think a lot of people become healthy because thanks to COVID, really, because they're just
Yeah.
popping kinds of different supplements.
Yeah. One point you made earlier that the more people are sick, it's a huge drain on the system, on the financial fiscal system of a country. I don't think this is wide knowledge, right? Like this. I don't think that people make that connection that a sick population means it's going to drain the exchequer. Finally, somebody's going to pay for it. I guess this is such a convoluted problem too, because there's lack of literacy about all of these things. And then the point earlier you made, the very first topic we were discussing, is that people are more obsessed about everything else other than these core issues that are affecting India, right? Like we're obsessed about religion or caste and this. Like from your personal viewpoint, Dr. Srikanth, like if you were in the driver's seat, like how do we? I mean, what are the things we could do? Like awareness is one thing. We both are talking about it. And when I was in India, this has been my personal experience too. A lot of times, dwelling on issues that really aren't that important in the hierarchy of things. Like I'll give you a quick example. To the point, the obsession with some of these things is so prevalent, ubiquitous in maybe the Indian population. Is that I was telling somebody I visited Bhopal. Hey, it was a nice city and things like that. And then the first thing the person says, Bhopal has got a majority of the minority, something like that. And I'm thinking, that is not the point of, that is not what I want to discuss about. It seems like there's all of these problems that are so urgently requiring our attention, but we're focused on these narrow group of things that, frankly, draining us, draining the country, and a small group of people are being benefited. But then when you scale back and look at the big picture, it's like all of these metrics you're talking about, a ticking time bomb. India is a ticking time bomb in terms of like healthcare and things like that. Like, whoa, we should be just waking up and trying to address all of these things. So from your personal viewpoint, like how do we stop the obsession? How do we get out of this mindset that, minorities or castes or whatever religion, and then talk about real growth? Like, I don't know. I don't have a good answer. I have several ideas. One of the things is to start the podcast and talk about these things. I'm trying to do my part in the thing too, and amplify whoever I can. I don't know. I'm sure you've thought about this. The long-winded question for you, Dr. Srikanth. Sorry, can you please take the floor?
Yeah. I mean, so I'll give a very short answer for this long-winded question. I think basically I would say education. We need to educate the people.
When you say education, sorry to interrupt you. When you say education, you mean not just K through 12, not just like we need to revamp that, education in terms of the quality of education we're giving to our children, for example, that has to be revamped. But you're talking even broader, even the adults today we need like a mass awareness campaign of sorts, right?
It's all into understanding what is real, what is fake, what is created, what is benefiting, as you said, a minority group of people who want to keep it that way to control the majority, and what should really majority do. What are the real issues? So it's not religion is not the real issue of the country is
Right.
facing. Development is a real issue. Bad roads are the real issue. Polluted water is the real issue. Polluted air is the real issue. Food adulteration is the real issue in India. These are the real issue. And if you don't focus on that, if you're always thinking about some mandir, masjid, or caste, or something like that, or some ethnic violence happening in Manipur now, and that kind of a thing, then you are diverted. You are not really focused on the real things. Then your attention is diluted, and you can't really achieve the goals that you want to achieve. So, in that sense, education is very vital. Not just education of the, the students and other things, but also education of the public in general about what is the real issues. That's it.
Yeah. What is it? I mean, like I think to myself, like, what is it? Like, is it like,
And the second answer I want to
yeah.
give was the accountability. I think what India lacks is accountability. Accountability is zero across all the fields. Okay. So I think, what differentiates a developed world from a developing or so-called third world is accountability. You take the accountability out of a developed world, it will become a third world. As simple as that. So, I see in every aspect of the Indian life, this accountability is zero. Oh, chalta hai, that kind of a thing, and nobody is accountable and responsible. Say, hey, put my hand up and say it's my responsibility. I will ensure this is done. If it's not done, I'll take the can. Nobody will say. They'll just hide behind opaque systems and okay, chalta hai. So hide behind opaque system, chalta hai. So this is once you bring accountability into the country, then I think the India will change rapidly. It'll be a developed country overnight, really.
Yeah, to your first point, like I'm thinking, you talk about education in general. Like I'm thinking, what are the solutions? Because I worked as a data analyst, a data scientist for a little while in my job, and one of the things you did was pull data, and then made these charts or bar charts or visual artifacts that helped drive the message home to people. Like we're making technical decisions and so forth. Is it that? Is it more, data that has to be shown, like, hey, this is a ticking time bomb, we should address it right now? Or is it a cultural, like, my intuition is that it's almost like a cultural upgrade, right? Like when we are talking about religion and all of these other things, versus all the burning issues, that sounds more cultural to me. Like the fact that we've forgotten that what is the fundamental thing? Health is a fundamental thing that we need for our country. Why is that not like the most burning issue? And to me, it sounds like, well, we've always had this kind of, I don't know, not always, but there has been this kind of communal tension and all of that stuff in India, even in the 90s, and Babri Masjid and all of that stuff. We had obsession with religion. Now it's more because of social media. That's why I feel it's more cultural. Like, even if I show a bunch of plots to people and say, look, the path we're on right now is going to lead us to hell. We should fundamentally change our thought processes and say, this is how we should think about these issues, and we'll have better outcomes for the country. And it seems like, like you have been trained in the UK. You've lived in the UK, and you've trained there, you've practiced there, and everything. You have this mindset, and I feel like, okay, I'm similar with me. I went to school here, work here, and everything. I love my country, which is my home country, as much as I love America. But when I look at my home country and I look at all these problems, I'm like, man, these things need to be solved yesterday. And when I talk to people about this, like, why aren't people making more noise about it? Why isn't there, like, I've had personal, I've felt things personally because of some of the dysfunctions in our country. It's more seems like somebody who's at an outside perspective comes to India and says, oh, this is what's going on, we should address it. Whereas folks in India, I feel like, my friends, I'll take for example, we're so used to bad news so regularly, we become desensitized to it so much.
Yeah, that's true. I mean, so if you keep on hitting with bad news, you get desensitized, and that becomes a number. They'll say, oh,
right,
100 died this year. That's better because 300 died last year. So
yeah,
100 died this year is bad enough, but
I'll tell you a number.
300 died last year, so this better. We are improving. So
yeah, I know. Sorry to interrupt you, but I'll tell you something like that very really happened to me. I was reading this number that in India, there are roughly 15,000 fatalities, road accidents per year in India. Okay, per month. That equates to about 300 per day, right? 300 people, if I'm doing the math right, is that right? 300 times, what am I doing? No, that's not 300. That's 500. Close to 500. 500 times 30 is 15,000. Close to 500 people are dying per day in traffic deaths in India. Okay. When I said this number to somebody, and they're like, "Oh, you're saying 500? I thought there would be more than that." And many people gave me this response. Many people, not just I asked this question just as a kind of a social test. It's like how much people are, what is the appetite, or rather, when are people going to lunge out of the seat and say, "Oh my God, we got to do something about it." 500 was not cutting it. 500 per day.
I mean, so that's the sad truth, really. But that's how
Which is preventable. The reason why I'm dwelling on it too is that it's preventable. These deaths, like pedestrian safety and things like that, there's a lot of low-hanging fruit on in the Indian traffic system that we could implement. Yes.
If a young person gets disabled, then he's a burden to the society.
Right.
Think how much the government has to spend, or society has to spend, or parents have to spend, or
such a loss it is to society too.
He'll be disabled, and they have to look after him till whatever next 15-20 years, and that's a lot of money drained.
Right.
Like you mentioned in Preventive. That's what I tell patients. See, look here. Now I'm telling you, take this medication to prevent osteoporosis. You're thinking, oh, doc, should I have to spend 5,000 rupees a month to prevent this? But once, if you allow the hip fracture to occur, then to fix the hip fracture, you will spend 2-3 lakhs.
Mm-hmm.
So, in fact, you are saving this 2-3 lakhs by investing 5,000 rupees. You think about it, then it will go to that sense. Otherwise, they say, why spend 5,000 now? Jab aayega, dekhe jayega. So that means when it happens, we'll see it. Then it's too late, my friend. It's too late. You're spending 5 lakhs. That's being penny wise and pound foolish, really.
Yeah. Well, Dr. Srikanth, I really appreciate your time on the Idea Sandbox. I will do my best to amplify your message, and I will splice in some videos just to kind of give context of our conversation, so that there's a bigger kind of like a bigger context of what we're talking about. We're just not discussing this as a one-on-one. This is something that needs to be addressed, and so I'll try my best to put some.
This is real patriotism, because sometimes I make a provocative statement. I tell that people outside India are more patriotic than Indians. It's Indians, but sometimes it's true, because people outside, they really love the country. They want to see the country develop, and that's why they're giving advice.
Yeah.
They're not like saying in condescending way, "Oh, you look
Right.
here, you are like this and you are like that." It's not like that. It's that things can be improved, because people have seen from outside the box what it looks like, how we can change the system, and they're giving constructive criticism. And then when it comes, if you take it, then you can change the country, rather than saying, no, what do you understand? You come to India, then you will understand. Sorry.
Yeah.
There are patriots in India, definitely, but there are equally more important patriots in say in Europe or America and Australia, and whole the entire Indian diaspora. And that's why Modi is going and reaching out to these diaspora, and we have to take benefit of them and their insight also into the problems, and solve the problems, rather than saying, no, we know how to deal with our things. Really, let's not be in denial. Let's be open to good
Right.
thoughts from all the directions. At the end of the day, it is to improve the country. It's to make India a developed country now, not in 2047. And that's the whole idea behind all this podcast, really.
Yeah. I to echo what you just said. I mean, I don't even look at it. I look at it even like one level above. This is a vast body of people, 1.4 billion of our fellow human beings. I don't, even if I was not Indian, I would be looking at my fellow humans as like there's these issues, and it's been solved. It's been solved in other parts of the world. We've had, it's almost formulaic at this point how these issues can be solved. We don't have to reinvent the wheel. There's a lot of things we could pull from there, from the ideas that they've come up with, and then just implement it on ours. It's not even that hard of a problem. This is like avoidable things, and we should be doing that. I don't know if you've heard of this. Like, they made this point earlier too, is that the Meiji Restoration. Have you heard of that by any chance? Japan Emperor Meiji in the 19th century. He was a very visionary guy. So when he found that the West, had gone far ahead in industrialization and all of that, they sent one of their top brightest people from Japan to travel to Europe and America and other parts of the developed world, go copy all those systems and bring it back to Japan, customize it for the local, context, and then make Japan a developed country. And look where they're at today, right? Like, I feel like sometimes we have this kind of like, pride that we are the best and all that. Like, well, you can also, pull these ideas from other places. And there's examples of that. Japan and South Korea are shining examples of how they, leveraged a lot of ideas from the West. So I think there's definitely that. Anyway, I'm making your point.
I mean, that's a great thing. Let good things come from all direction.
Right.
Even our Vedas say the same thing. Let good things come from all our direction. So why don't we apply it? We quote a lot of Vedas and all our past and everything, but we have to live in the present. We can't live in the past glory.
Yeah.
Yes, India was a great country. I completely agree. It was fantastic selection. I completely agree. But let's bring all those good things to now, so that
Right.
our people can benefit now, rather than we live in the past saying, "Oh, my ancestors were great." Like our guru was to say, yes, your grandfather was Maharaja Chakravarti. What are you, a beggar? What's the point? You have to be Maharaja Chakravarti now. That's more important than your grandfather being the emperor of emperors. So, let's be in the now, and let's make this a beautiful place, a better place to live for everybody.
Yep. Thank you, Dr. Srikanth. Have a good night. I know it was late. I really appreciate your time.
Same to you. Thank you very much.
Thank you.